Good afternoon, everyone. We're just going to wait another few seconds for a few more people to pop on, and then we'll begin. Welcome to our first advocacy webinar of 2025. I'm Mandy Sankula, your Director of Partnerships and Communications, and it's my honor to be here today to introduce to you our advocacy team, Lindsay, Chris, and Ryan. So next slide, please, Lisa. And they're going to be here today to give you some highlights from Washington and some legislative acts and priorities that are taking place, and kind of just give you an overview of where we're at so far this year and where we're going to be going. So I'm gonna let these three take it from here. Thank you.
And that's for me. I'll take it over. Thank you, Mandy. Appreciate it. And it's great to have everyone on the webinar today. And I'm really just happy to be able to provide updates for you. I wish we could say that nothing has happened since we last saw you and talked to you and, met you in person and, everything in between. But my goodness, it has been quite a roller coaster since February. But we're gonna get you through everything, and we're gonna be your resource that you need. So today's agenda, we're going to go through the February fly-in recap. Really excited to be able to report out on that and all the great work that we did leading up to it, during and after. We'll have a legislative priorities update, and then we'll provide some information on the latest on all of the health-related nominees in the federal for the federal government and the Trump administration. And then we will wrap up the webinar on 2025 healthcare-related activity, including policy efforts that we're working on, and of course everything that we're doing to support our advocacy efforts with Mended Hearts in Washington and across the country. So let's hit that next slide, please. All right, I got lucky that I get to do the recap because it was just such a fun event and such a fun day, and it didn't happen overnight. It was something that we all had to put all of our work into, including you guys, including the Mended Hearts team, our team, getting you guys to Washington on what was the only day this year that closed the government down, at least partially, for weather events, which usually happens at least once or twice a year, sometimes more in a year. But we were so grateful to have everyone's smiling faces in Washington on February 12th and February 11th, and for some even February 13th. But it was really such a great week and just wonderful to have everyone in. We hosted dozens of you advocates in Washington, D.C. to meet with key congressional offices and committee staff to discuss all of our important heart health issues. It really went so well. Maybe I'm biased because I had an awesome group, but I think everybody did. We divided and conquered in a very challenging day where we had to switch to virtual, fly by the seat of our pants, but not really, because we were very prepared. You guys were prepared. And we had a lot of success. Over the course of the fly-in, the day's work that we put together, all of you advocates participated in over a total of 38 virtual congressional meetings, which is, I would say, that's a marker point for us. 38 virtual meetings in one day, that's a big deal. So you guys did an incredible job. We had 11 meetings with U.S. Senate offices, 21 meetings with U.S. House offices. That's a great ratio. 6 meetings with Senate and House committee staff with health policy jurisdiction. These are the staffers that make sure the legislation is moving through committee to hit the floor to get signed into law. And then on follow-up, the Mended Hearts team reached out on March 4th. Good timing. You didn't need to follow up the next day. Everyone needed a break, but we sent out a follow-up thank you note to all of the offices who we met, and we received dozens of responses indicating not just a thank you for meeting, future support, but we even had some people say, hey, guess what? Since we last talked, we got to remember on that legislation that you discussed with us, whether it was priority 1, 2, or 3. We had great feedback. And I can say after doing many of these with other groups, not as special as you guys, but this one was definitely one where we've got great feedback, and you put in your work, and it shows because a lot of people agreed to sign on. And that's just the beginning. We have more work to do to follow up with those offices, get those original sponsors and co-sponsors, and move the legislation that we find to be the most promising and bipartisan, hopefully. So I think we're heading to the next slide, but I just want to say again, it was an incredible day and week of meetings and events, and I'm just glad everyone made it. Hopefully you'll come back again in the near future. I believe I'm handing it over to Chris next for the follow-on slides, but I'll be here to jump in if need be.
Yeah, thanks, Lindsay. Great to see everybody on the webinar again. I recognize a lot of the names that were at the fly-in that Lindsay was just talking about, but a lot of people who weren't at the fly-in. So what we really wanted to do was give everybody an overview of the significant legislative priorities that we talked about during our fly-in, the ones that we've identified for Mended Hearts as priorities over the course of 2025, and what's happened since our fly-in in February, because there's been some pretty significant updates since then. There's 4 on this slide, and there's 1 on the other slide that has a little bit more info, but just so everybody is aware of what those 5 key priorities were. The first one was the Accelerating Kids Access to Care Act, the Safe Step Act, PBM reform, pharmacy benefit manager reform, inflation reduction, drug pricing reform, and then the Treat and Reduce Obesity Act, which is on the next slide, which I'll get to in a second. Oh, sorry, back 1 more slide. So those were our 5, but I think really exciting. I think it was just a week or 2 after our fly-in, the main sponsors of the Accelerating Kids Access to Care Act reintroduced that bill in both the House and Senate. On the Senate side, it was Chuck Grassley, Republican from Iowa, and Mike Bennett, Democrat from Colorado, who reintroduced that bill. And then on the House side, it was Lori Trahan from Massachusetts and Marionette Miller Meeks, the Republican from Iowa. Like I said, that was just 1 week after our fly-in. The House bill has over 27 co-sponsors, and the Senate bill has 30 already. And many of those co-sponsors are offices that we met with during our fly-in. So it's just a great way to show the actual tangible impact. Some of whom were not, previous co-sponsors. So, it's a great way to show the actual tangible impact that our advocacy had in February. And just to kind of make sure everybody remembers what that bill is, what it does is it streamlines the process for children who receive care across state lines and do so through Medicare. It streamlines that process so that healthcare providers across state lines don't have to do these multiple applications to make sure that they're able to treat those children. So it really is a way to get healthcare access quicker and more effectively for kids. Moving on to the Safe Step Act, and again, just to kind of recap what that does, there's basically a process. It's also known as fail first, where sometimes this happens, especially if you're switching insurers, but they may make you try a drug that is perhaps less effective or may give you more harsh side effects, but it's cheaper, so it's cheaper for the insurer, and they make you try out these other cheaper drugs before getting back to your more expensive medication that you may have been on previously. So the State Safe Step Act wants to sort of eliminate that process. This is a bill that we've had a priority since last year, and has a lot of support in both the House and Senate, bipartisan support. It's not been reintroduced yet, but we spoke to many of those lead sponsors during our fly-in, and we were assured by all of them that they were working on it and that it was going to get reintroduced, and it was really just only a matter of time. So hopefully that should be soon. I think we'll have something to report positively on that in the near future. Our other priority that we talked about was Inflation Reduction Act, or the IRA, as you see there, drug pricing reform. There was a lot of skepticism, or I don't know if that's the right word, but a lot of rumors about how the Trump administration might change this program, how Congress was looking at changing this program. And right now, the Trump administration hasn't really done a whole lot to address that. In fact, they've allowed the Centers for Medicaid and Medicare Services drug price program to continue as is, which is a good thing, especially for the medications that have already been included in that program that relate to heart health and heart patients. So hasn't been a lot to update there. There's a lot of other bills, bipartisan bills, that members of Congress want to be considered to extend the market exclusivity periods for some genetic therapies, some of these drugs that treat rare diseases, which we feel is a good thing because it will help companies continue that research and development process into drugs. So, those are just a few things we're watching. There's no real clear pathway for Congress to address those, in the short term, because there's a lot of other things that they're working on, as Ryan will get into in some later slides. But, once again, we're keeping our eye on it. It's a similar story for pharmacy benefit manager reform. I've said this before on previous webinars, but there was a very large healthcare package that was proposed at the end of last year that would have had some significant PBM reforms attached to it, along with many other healthcare provisions. But unfortunately, that was dropped at the end of the year. However, there are a lot of members of Congress, Buddy Carter, who's the chairman of the Energy and Commerce Health Subcommittee, and Diana DeGette, who's the ranking member on that subcommittee, really want to see that package revived. And they're still doing hearings on this. So we know it's top of mind for a lot of these members. There was just a hearing on February 26th, once again examining how pharmacy benefit manager reform can make drugs cheaper, make them more affordable, make them more accessible to heart health patients. So not a lot of activity there, but it is definitely something that we are keeping our eyes on and expect to come up in the short term. Next slide, please, Lisa. And finally, we have the Treat and Reduce Obesity Act. This one is a really interesting one. It has had some activity recently, which is why it gets its own slide. So it says in January there, but it was actually in December. In the waning days of the Biden administration, the Centers for Medicare and Medicaid Services proposed a rule to cover anti-obesity medications, or AOMs, under Medicare and Medicaid. And they did this because it would be a chronic disease treatment option. So, when President Trump and Republicans took over Congress at the beginning of the year, there was a lot of uncertainty over how they would address this final rule. They could have, because it wasn't finalized when President Trump came into office, he could have potentially just canceled it and gotten rid of it. We didn't really know how they were going to respond to it. But the good news is it recently has moved to the Office of Management and Budget in early March for final consideration. So I think that's a really, really good sign that they are considering to move forward with this bill and getting it finalized. Even more of a positive indication, I think, was Senator Bill Cassidy's staff, who we met with during our fly-in, but his staff later said, publicly that, consideration for the legislative portions of TROA, the congressional side of it, is actually paused until the Trump administration decides how they want to handle that proposed rule. So once again, I think that's a really positive sign that, there's no real point in them moving forward with the TROA if they think this is going to be done, from the agency's perspective. So, having said all that, there are a few differences between what the rule is proposing and what the bill in Congress would specifically do. The TROA that was introduced last Congress, again, just to reiterate, this has not been reintroduced this year. But what that bill from last year would have done was it would have covered AOMs only under Medicare, but it would have also expanded Medicare Part B to cover intensive behavioral therapy for obesity to more healthcare providers. So, just to clarify once again, the TROA, the legislation was only covering under Medicare. What the CMS proposed rule is doing is allowing it to be covered under Medicare and Medicaid. And then just one final point to make, why I think there's even more good news for the TROA. CMS also decided to include Novo Nordisk's Wegovy in their second round of price negotiations. So, why I say that's a good sign is because theoretically, if CMS does approve this rule, or if the TROA does move through Congress, it'll make these drugs less expensive, which is a big it's a big argument against the passage of the TROA because it is such an expensive bill. I saw one estimate recently that said, for CMS to cover Medicare and Medicaid, it would cost over $35 billion over 10 years, which is, is a pretty large bill. Next slide, please, Mandy. So finally, we wanted to give you guys an update on where key agency key healthcare nominations stand in the Senate. The Senate is obviously responsible for vetting and confirming all of these nominations. So as I'm sure most people on this call are probably aware, Robert F. Kennedy, who was President Trump's HHS secretary nominee, he was confirmed on February 13th. So he's been in that role for a little over a month already. He's obviously been very active, and there's been a lot of reporting over what his first agenda items at HHS would be. But having said that, I think he was also waiting for a lot of his deputies, his undersecretaries, to be nominated and put into position also. A lot of whom haven't been confirmed yet. So. For the Centers for Medicaid and Medicaid Services, we had Dr. Mehmet Oz. He had a confirmation hearing at the Senate Finance Committee just this past Friday. So he is still pending a Senate confirmation vote. And I don't believe that has been scheduled yet. So that's still TBD. Same thing goes for the FDA Commissioner, Dr. Marty McCary. His nomination was advanced by the Senate Help Committee also just last week. So he's still pending a full Senate vote. The NIH director, National Institutes of Health director, Dr. Jay Bhattacharya, he was also advanced by the full committee just last week, but again, still pending a full Senate confirmation vote. And finally, sort of a big news story that broke last week. Representative Dave Weldon, a former representative from Florida, who was President Trump's nominee to lead the Centers for Disease Control and Prevention. His nomination was actually just withdrawn last week, right before he was supposed to have a confirmation hearing, reportedly because he just didn't have the votes to get through committee. So that was a bit of a stunner. I don't think he was even aware of it up until the nomination was pulled. So we are still awaiting a new nominee to lead the Centers for Disease Control. And with that, I think I will turn it over to Ryan.
Great. Thanks, Chris. So I'm going to go over the budget reconciliation update. Budget reconciliation is a legislative process here in the U.S. Congress that allows for expedited consideration of certain tax provisions, anything related to spending and debt limit, and enabling passes with a simple majority in the Senate and bypasses the filibuster process. We see this when an administration changes over. It's usually the quickest, easiest way for Congress to sort of get some major changes implemented within the first year. So as an update, GOP, Republicans in Congress are using this process to extend the 2017 tax cuts and to make other revenue changes and federal spending changes. The House and the Senate must both pass identical budget resolutions to proceed. The House and the Senate in February both passed their own budget resolutions, but they do need to come to an agreement and pass the same bill here to be able to move forward. In the House, the House version calls for the Energy and Commerce Committee to make $880 billion in changes over the next 10 years. The healthcare implications here are to pay for these policies. Significant changes to Medicaid, Medicare, and ACA must be made, as well as other cost offsets. Those changes could include Medicaid changes to block grant states, or making the federal matching rate equal across states, installing work requirements, limiting fees imposed on healthcare providers, such as hospitals and nursing homes that help fund the state Medicaid programs. Proposals to reform Medicare suggest reducing payments for unpaid medical bills and ensuring equal payment rates regardless of where the care is provided. and any impacts of federal changes to Medicaid spending will vary state by state. I think really the takeaway here is that there's going to be there already has been a lot of concerns being voiced by constituent groups that Medicaid, Medicare shouldn't be touched during this process. President Trump has been public in his efforts saying that he doesn't agree that we need to be touching those programs. However, internally discussions within the conference, it's going to be near to next to impossible to make those changes without touching these programs because they are a considerable amount of the budget. And so I think it's going to be very difficult for Republicans to, make the offsets without touching these programs. So in the coming weeks, the Energy and Commerce Committee and other committees are having meetings on how this is going to play out. But as of right now, the message between the administration and the message between Congress isn't necessarily on the same page. Next slide. Yeah, so I think as Chris might have mentioned, Congress passed a continuing resolution last Friday. The House jammed their continuing resolution through earlier in the week and then left Washington, leaving the Senate jammed to essentially pass the House version of the continuing resolution or allow the government to close, to shut down. Democrats really were torn between shutting down the government or making a stand in pushing back against a lot of the administration's priorities and efforts that have been going on the past few months. But in the end, I believe it was 8 or 9 Democrats decided to end up voting for cloture and allowing the process to move forward. So at this time, the government is being funded through FY24 levels through the continuing resolution for fiscal year 25. Which means now the administration and Congress are pivoting to fiscal year 26, which will begin on October 1st of this year. One of the first steps that usually happens, and this is not in the slide, but the president's budget request typically is published early on in the year, usually in February. However, with the change in the administration, that has not been made public yet. And so Chris and I were actually discussing before this call when we might think that the PBR would be made public. And at this point, I think he and I are in agreement that we're thinking May. A lot of work goes into pulling together the budget request at the administration level, then it has to go through the office, the budget office, and then finally be published and made public, sent over to Congress and be reviewed. However, Congress does not wait for the administration to make their request known. At this point, Congress is now fully focused on FY26 and is going to be working towards producing that legislation. The House and Senate Appropriations Committees have been accepting, or at least members have been accepting FY26 requests for funding levels and all that. So very much, even with FY25 just being finished last Friday, they are full steam ahead on FY26. And so in this CR that was passed last Friday, one of the things of concern and of note for our group here is just the reduced funding at the National Institute for Health. This was reduced by $280 million through the innovation account. On February 7th, the NIH also announced a cap of 15% on the rate at which it would reimburse research universities and other funding recipients for expenses categorized as indirect costs. At this point, there is an injunction, a court-ordered injunction on this order, essentially blocking that for now. And so that's one of the many things that, as we discuss this, a lot of the executive orders through the Trump administration are being either litigated through the courts, have already been litigated, or most likely will be litigated. So there's a lot of moving pieces here and it's very issue specific on what part of the process, each specific priority or issue is currently being held out. Leaders of the Energy and Commerce and Health Committees are in support of doing NIH reform. There's a lot of discussions at this moment, not even, even outside of NIH, but CDC and other HHS related reforms. And so really looking to focus more on basic research, balancing the research portfolio, changing the process for evaluating research proposals. And so as those changes are being made, Chris and I can provide updates on NIH reform and other CDC reform, things like that. But I think something else of note is just the Make America Healthy Again Commission, MHI. There was an executive order published aimed at addressing the growing health crisis in America by reducing chronic disease rates and improving overall health, especially amongst children and youth. This directs the NIH and other federally funded health-related research agencies to focus on the root causes of chronic disease. This is a big priority for Secretary Kennedy. It's something that he campaigned on even before he was nominated to become the Secretary of HHS. But this is going to be, I think, a full government effort, this MHI movement, this commission. And so there's going to be a lot of changes, I think, within the next couple of months to the year under Secretary Kennedy, under President Trump to, address some of these chronic diseases that we're seeing throughout our society. Another executive order that has been, championed by the administration is healthcare price transparency. On the 25th of February, Trump signed an executive order boosting enforcement of rules requiring hospitals and health plans to post detailed pricing information online. And I know, for many of you, this is of concern because, you go to the emergency room, you go to the hospital, you're not really positive what you are going to be paying in the end. And so this is something that's been around for a while that I think HHS has been trying to nudge individual providers on, is these transparency requirements. And so the fact that, the president within the first month of his administration has put out an executive order on this shows, I think, they're looking for real change and transparency here on this priority. Next slide. Yeah, so the Chronic Disease Flexible Coverage Act was passed in the House last 2 weeks ago. What this bill does is expands preventive care benefits for high deductible health plans for drugs and things that are high cost. And so for individuals on a high deductible plan, you don't necessarily have to hit your deductible before cost sharing comes in. This was, a lot of the medications that we as a group are looking for easier access, lower costs for are very expensive. And so this is just one piece of legislation that is passed in the House that is looking to address some of those concerns from our constituents to bring those costs down. Chris, do you have any other feedback on this piece of legislation specifically?
Yeah, I mean, what this really does, at the bare bones of it, is it treats all of these items and drugs and treatments as preventative care, which is why they're then able to be covered by high deductible health plans, assuming those plans are tied to a health savings account. Also, that's really the only other qualifier. And I don't know if there's people on the phone who aren't actually seeing these slides. We do have a table on this slide that lays out there's 14 specific new things that this bill would allow to be covered. And there's 4 that specifically relate to heart disease and other heart issues. So I'll just read those out real quick. The first one is angiotensin converting enzymes. The second one is beta blockers. The fourth one is low density lipoprotein testing. And the fourth one is statins. So those are the four things specifically related to heart and other health issues that would potentially be covered under this bill. And just one other thing, maybe to clarify on this bill, this does not necessarily force insurers to cover these services or treatments before the deductible is made. What this does is it codifies or it puts into law guidance that the IRS put forward back in 2019 that said that these high deductible plans could cover these things. So it doesn't necessarily, the Senate would still have to pass this bill, but I just wanted to, make that point that your health plan is not going to be forced to cover these things necessarily if this eventually becomes law.
Next slide. Yeah, so I think, Chris and I are very much interested in, having a discussion about any sort of, executive orders or questions on executive orders, a lot of the action that's been taken over the past 2 months by the administration, any updates that you'll have, questions on the Congress, things of that nature. So Mandy, we'll just,
Yeah, please go ahead, put your questions in the Q&A or in the chat. I don't see any yet, but while we're waiting for that, I had a quick question, guys, about the NIH cuts. So it says that there's, I guess it's basic research, that's going to be the focus. What does that look like? It looks like, to me, innovation is not something they're really interested in. What's this basic research mean?
Yeah, I think what they're really looking to do is, when you hear about a lot of the hearings that they've mentioned, I mean, you even heard Trump mention a lot of these during his address to Congress. If you listen to that, there were sort of very specified research projects that he mentioned that the NIH is doing that doesn't have wide applicability, right? They're very targeted, they're very narrow to very narrow things. So when they say that they want to get back to basic research, what they're talking about is getting back to the things that are helpful to broad arrays of patients and groups, right? What's the basic research that the federal government, federally tax-paid research can provide that can then be expanded on by, say, other pharma companies or other research institutions that can be built on. So I think it's not I don't want it to be misconstrued as they're taking away research abilities or research responsibilities from the NIH. I think it's just boiling it back down to what is going to be the most basic research that's applicable to everybody.
Okay.
And I don't know if Ryan or Lindsay has anything to add to that.
The general sentiment right now is a panic and a strong reaction, rightfully so, because a lot of it came without very detailed descriptions about what would be safe, how it would be managed. And I think that's just the nature of how this administration wanted to do a quick first chaotic press against a lot of the spending and funding that exists at the agencies, including NIH. However, it is the first quarter of the year of the administration. There are 4 years of this administration with a lot of questions to be answered. What we're learning is members of Congress are receiving a lot of feedback from their constituents, their universities, their nonprofits, the different organizations that have questions and concerns, and they're filtering them through to the administration. You don't even have Bhattacharya in place yet, for example. You have a lot that's still left to be unknown. And what we're getting meeting with the Energy and Commerce Committee and the Health Committee is that I think that this administration really wants their leaders in place to make good decisions for how this administration wants to move forward with as Chris said. So I won't repeat what Chris said, but that's generally the direction they're giving us. I'm not making an excuse for what has just been a haphazard approach and confusing approach to the public and all the public interest. But I do think it's a little too soon to be able to say, oh, they're throwing the agency out, they're throwing research out. I believe that there's enough emphasis and support and bipartisan support that it's going to be more of a breakdown to build back up in the vision of this administration. And I think that members of Congress, that's why you're not seeing too many Republicans out there remember when Donald Trump was in office and making sort of obscure approaches because he'd never been president before, he'd never been elected official before. And Republicans were just, raising up their hands and very upset, and Democrats all the like. And it didn't work to create solutions very well. And it actually made the president push back and not really want to work with Congress. But I think that there is enough faith in the members of Congress that are operating these committees of jurisdiction and have interest at their state and local levels, that I do think there's going to be a dialogue. You're just not seeing it right now. The public is not getting the visibility of how they're making these decisions and what they're doing. It's not that dissimilar from a company or corporate interest making major decisions to reduce their reductions in force and look at their budget and spending and redevelop, or if they're acquiring other companies. I think about it in terms of business, because that's really what this president said he was going to do, and now where he's leaning on industry to show how have you made efficiencies in government. So again, I'm not making an excuse, but I'm just trying to have everyone see it from a different lens. And if I'm wrong and they're not starting to fix some of these big questions that are super important and actually have incredible return on investment in the 3 to 6 to 9 months, then there's going to be a lot of pushback, and the president's going to see loss in the 2026 election in the House and the Senate because of it. And I don't think that's what his intentions are. So I think that means that our job is even more important, because we have to highlight this is something I remember talking about quite a bit, especially in our group, the number one killer of Americans is heart disease and heart-related conditions. And it's the costliest, not just the most deadly, but it's the costliest. So I think that there's a lot of room and space for us to remind the members of Congress who we worked with through legislation, through advocacy, through letters, no panic, but really approaching it methodically with data and actual examples of life itself, and allow them to communicate that to the administration and these officials that are getting their footing in their respective agencies. So I'm not a pastor or a preacher or a therapist, but I do want to make sure that we're approaching this as in the long-standing terms of the organization and the success we want to have on the work we're doing.
Okay, thanks, Lindsay. We have a couple of questions now, and then I do see your chat, Jennifer, as well. Susan's concerns are around organ recipients and transplant. I didn't hear you guys talk about anything specific research related to transplant or organ donation. Do you guys have any updates from that area of research?
Yeah, I'm not aware of any cuts or changes there. I don't think there were any cuts to HRSA, for example, that were made in the continuing resolution that Ryan talked about. And in terms of specific cuts to organ transplant research or anything like that, I don't think that information would be out just yet. Unless it's like a specific high profile research funding that maybe got cut when the 15% stuff came out. I don't think there's a way for us to know how NIH's focus would shift or what specific programs may have been cut yet. I think it's a little bit too early for us to know.
Thanks.
Nothing to add, but we'll flag it because we know it's important to this board.
Yeah, great. Thank you, guys. Melissa asks, and I think this is to Ryan, your last slide. If insurance companies won't be mandated to follow new legislation, then what's their incentive to, the chart you had up with those 4 cardiovascular drugs?
Chris, do you have more information on that?
Well, I think the incentive is, from an employer's perspective, if you have plans that are offering these services, why wouldn't you go with that plan over one who's not? I think that's the incentive. And
okay.
I think she's right. It's not like there's a monetary incentive. There's not like there's a tax implication here. I think because high deductible plans are tax advantage, you'll see people say I will go. So I think those regulations that surround them are typically a lot more stringent. So this is just, allowing more flexibility within the program.
There are a couple of comments around the fact that, the government looking at this as a business and profit motivation when they should be people oriented. That there are a couple of comments around that. And then also, Jennifer, can you put in the chat what template you're talking about? In terms of a specific issue that you want to write a letter to your legislators about, or what? But yeah.
I'm gonna take this one and assume I know what Jennifer's talking about, because I mentioned that we would want to, that what a lot of people are doing are communicating to members of Congress about where the cuts are going to impact their lives, and providing the data, providing statistics, providing the history of the programs that individual patients have benefited from through the NIH, the resources provided. We can talk about ways to do that, but we also, and part of my suggestion is that before we light up the switchboards, that we actually see the Bhattacharya comes in, or we identify if there were to be cuts, what would be the most significant. It might take a little bit of introspect to see where we would even want to raise concern with administration. We are taking a tactical approach where we want to be able to go in as resources and advocates, not only to Congress people, but into HHS, into the departments, to talk about the significant items that impact our lives and your lives. So I want to make sure that we can walk in, and our opening salvo is, here, listen to us. You should know what we're all about, what we've been doing, where we need support, rather than coming in, bearing torches and trying to burn the place down in the early weeks of the administration. And in terms of the identification of it being a business, I use that because we have a businessman in office. It's more philosophical than it is trying to make money off of R&D. Well, that's not the intent of my comment. My comment is more about try to understand where the actions are coming from, and where the focus is on. It is very America first. It is very protectionist. It is very deficit oriented. This has been a rallying cry that got Donald Trump, quite frankly, elected, and House of Representatives and Senate to be Republican, because a lot of the conversation around the national debt and where our federal spending is going, where our taxpayer dollars are going, that doesn't mean that the value of those taxpayer dollars aren't seen through the return on investment, which is, saving lives and saving money. So you have to try and present your advocacy in a way that is understanding to the person, the recipient of our letters and the recipient of our talking points, the way that we did with members of Congress in the different offices. So I would say that is just really, again, philosophical, not necessarily something that the president has written down, that the NIH is a business. I'm treating it like a business. That's not exactly where we're going with that. But I understand frustrations, and we hear it across all groups that we're working with, including the universities that we represent, the nonprofits and Help IT. We represent a group that works with the CDC. We're catching all kinds of questions there. So, but I just know, because we went through this with 4 years of the first Trump administration, where we had a lot of unknowns, that it took some time to truly understand how to work with them and really how to deliver a message that I don't think the president would disagree with anything that we're asking for or wanting to speak about with members of Congress or policymakers or officials in government.
Thank you, Lindsay. And Jennifer thinks that's very helpful.
Thank you.
Yeah. Any other comments or questions, guys? Okay. Well, you can email any of our staff at any time, and we'll pass any questions you have as they develop along to the Troutman team. And keep an eye out for our monthly newsletters. We keep you up to date there, and in the Heartbeat magazine articles every quarter as well. So Troutman, we are glad to have you here to guide us through a very tumultuous time and to answer our questions. So thank you very much for today's presentation, and thanks to everyone for being on.
Thank you, and we will try our
you.
best to continue to answer the questions as we learn them, as we learn the answers.
Thank you, and this will be recorded. It has been recorded and will be on our YouTube channel tomorrow, guys. So thanks, everyone. Have a great day and evening.
Bye.